Hello people, in this video let us look at this topic spondylolisthesis. So look at this image here. The normal spine, okay, will have this Scottish dog, yes, but without collar, okay, the oblique view of the vertebral column you're looking at. Here in this spondylolisthesis, where it is lysed, there the dog will seem to have a collar, okay. So understand one thing, whatever we are showing here, the first image is normal, okay, this is normal. This one is spondylolisthesis, where there is lysis, so you can see a collar in the dog, right? And in spondylolisthesis, this is what we are looking at in this video, right? Spondylolisthesis. In this, what has happened, the dog seems to have some kind of a pulled neck, right? Collar and dog seems to have a pulled neck. Actually, what has happened here, if you observe the intervertebral disc, the disc is compressed, okay? What has happened to the disc? The disc is compressed, okay? And the vertebra has come forward, okay? So this is spondylolisthesis. What is this? The anterior displacement of the vertebra, okay? Of the what? Of the vertebra, not of the disc, okay? So this is spondylolisthesis, okay? So here you can see they have shown you spondylolisthesis. So there is some break and there is some anterior displacement, okay? That's what they have shown in this image. But however, just look at what spondylolisthesis is. It is the forward displacement of a vertebra, over the one below it, okay? So it can happen in your lumbar spine. So you can just remember L5 S1 or between L4 L5, okay? Between this either L4 L5 or L5 S1, okay? Just remember this. So the lumbar spine. So these people will have backache, lower backache, okay? So spondylolisthesis, forward displacement vertebra between L5 S1, L4 L5. This is of the vertebra, remember, not of the disc. And sometimes it can go backwards also. That is called as retrolisthesis, okay? Now why normally it doesn't occur is because of the articular process, etc. The way it articulates, it will not allow the movement, okay? It is prevented by some articular processes. Now what happens? There is some problem in this disc or etc. of these check mechanisms, ligaments, etc. So the displacement occurs. Based on this reason, there are types of spondylolisthesis. You have the isthmic, okay? So this is the commonest and this will be in young people, okay? This will be in young people, remember, because this is nothing to do with degeneration or something. This is in the young, okay? So this is in the young and this is commonest. This is the lesion is in pars interarticularis, okay? So you saw that dog collar broken, it has a collar kind of a thing and it is pulled, okay? So there is lytic, the fatigue fracture, remember, of the pars intraarticularis. Intact but elongated pars intraarticularis also can be there, okay? Either it is fractured or it is intact but it's elongated, or there is acute fracture of this pars intraarticularis. What was this? Fatigue fracture, and this is acute fracture, okay? Look at the pars intraarticularis, it's there here. This is only that from side, from oblique view, it look like Scottish dog looks like. This is the pars intraarticularis, okay, which is the one that is fractured, either acute or lytic fatigue fracture, or it is pulled kind of a thing, okay? So this defect will allow the separation of the two halves of the vertebra. The anterior half along with the whole of the spinal column above it slips forward over the vertebra below. The posterior half of the affected vertebra remain with the lower vertebra. Okay, so the anterior half along with the whole of the spinal column slips forward. So only half of it, is it? Only half of it. So two halves of the vertebra are forming. So it is not the entire vertebra which is going forward. Two halves of the vertebra is formed and the anterior half is going forward along with the spinal column. Okay. And the posterior will remain with the lower vertebra. Okay. Then you have the dysplastic, in which it is, this is the least common. Congenital abnormality is there. The development of the vertebra itself, the vertebra slips over the other in the development itself. Degenerative is in old people. Okay, isthmic was in young people. Degenerative is in old people. Because of osteoarthritis, standard things that you write in these people, osteoarthritis, So the joints itself become unstable because of osteoarthritis, and then this will subluxate. The vertebral displacement usually actually in old people is backward, they are saying. So it is retrolisthesis in old people, okay, but the name still is spondylolisthesis only, okay. Displacement is usually not severe also, like they can enjoy life, okay. Neurological disturbance also is unusual, so no problem. Pathologically also this spondylolisthesis can happen if it is bone disease, etc., weakening, you can say all that. Traumatic also, some trauma pushed it forward, okay. Now clinical features, what will these people have? Lower backache, we already told you, and the symptom becomes worse on standing or walking, and usually sometimes these people can be asymptomatic, and in a routine x-ray you can find out that these people have a spondylolisthesis, okay. On examination, what will you see on examination, on physically examining the person? Palpable step above the sacral crest. How did they find out the step above the sacral crest? There may be increased lumbar lordosis. So where is that lumbar lordosis? Bring that lumbar lord. This guy's lumbar lordosis would have increased. So it become more curve, I am thinking, because it has gone anterior. Lumbar lordosis looks like, right? So stretching of the sciatic nerve can happen. See, now they're talking about some nerve involvement also. There can be stretching of the sciatic nerve, and this you can know by straight leg raising test. Here they are doing some straight leg raising test to check the sciatic nerve stretching. X-ray, what will you see? Anterior displacement. Everybody will say you will see displacement, and in this you can grade. Grade 1 means 25% has gone forward or something like that, and grade 4 means completely forward. Here they are showing some displacement. And don't forget to mention this sign. You will see a pars intra-articularis where the separated neck, and what else will you see here? The Scottish dog's head is separated from neck. Then the patient has spondylolisthesis. Okay. If it seems to be wearing collar, it is spondylolysis. If it is seeming that the head itself is separated from the neck, it is spondylolisthesis. Okay. Now let's look at the treatment of spondylolisthesis. Principles of treatment, you will give them a brace. For mild symptomless, no treatment. Conservatively, what you can do, if the symptoms are mild, brace, spinal exercise. When symptoms are moderate, what will you do? You'll do an operation, okay? What are the conservative ways of treatment? Rest. You give them some support. Then you teach them some flexion exercise. Change the job to a less physically demanding one, if available. Operative methods, decompression of the compressed nerves. Remember, you have to decompress that sciatic nerve if it is affected. How will you do this? By fusion between the transverse processes of the adjacent vertebra. This is important. This is something you will not realize in the exam. You have to fuse something between the transverse process of adjacent vertebra. Transverse fusion you should do, okay, so that it will get support and it will not displace anteriorly, looks like, okay. Use of internal fixation devices like pedicular screws and rods, yeah, standard orthopedic procedure where you fix, has helped in early mobilization of the patient. This textbook gives very little information, but anyways, let us focus here again on the treatment. What is the treatment? For symptomless, no treatment. For mild, you can give some brace, spinal exercise, etc. If it is moderate, you'll have to operate. Now, what are the conservative treatment? You'll have to rest, external support, teach some flexion exercises, change of job, rest, obviously. Operative, you have to decompress the nerve, then you can do some intertransverse fusion, then internal fixation with screws and rods. Okay, that's it for now. Bye-bye.